Thank you, Partho, for the nice presentation. The initial part of presentation was really frightening. We were thinking that we are going to be replaced, we are going to lose our job, how we'll run our families. But the penultimate slide was slightly reassuring. Anyway, thank you
Yes,
very much for a nice presentation.
well, thank you for having me, Dipankar.
It was a pleasure. Any question from the audience or my co-chairpersons or the other panelists? Rajat, you were very keen about this topic. You have something to ask?
It sounds very interesting. Thanks, Dr. Sengupta, for taking us into the future. We will get back to the present very soon. But it sounds exciting, and the logic of AI makes a lot of sense, because I was just talking to Dr. Kumar about this, that we're having too many criteria for last resistance function. And perhaps instead of devising a scoring system, the AI could take over and take in the multiple input sets. Yes. Dr. Kumar, please.
So I think I'll just respond to that. Our lives are very busy and we don't have time. All this complex decision pathways and all the ASU recommendation pathways and all, it's very difficult. Number one, to remember them. Number two, to be able to use them. So I don't see AI basically a technical challenge. I think it is going to come and be automated and immersed. And just like we have evolved in using our cell phones and utilizing Zoom conferences, it will be automated, seamless evolution where the solutions will be integrated along with our way we perform echocardiogram. But the biggest, at least from my side, I feel like we need to be able to get time back for seeing our patients and connecting them at the human level. So that's what I call as we're augmenting our work to free up time so that we can participate. I mean, all this diagnosis that if you're going to spend 80% of the time to diagnose and you have no time to take care of patients, discuss the solution, I think that's not the ideal way to move forward. So we need to reduce the time for diagnosis and discovery to 20% and 80% time more to discuss with the patient what they want, what their goals of cares are, what do we want to see, what kind of therapies, we need to be able to find time for that, for the quality of the patient-doctor relationship, which is currently not there many times.
Yeah, congratulations, Dr. Sengupta. It was absolutely thought-provoking, your lecture. And apart from, the message that we could arrive at from your talk is that AI is probably going to make our work simpler, that it is going to relieve us of the tremendous data burden. I was just talking about an hour back or so, between ourselves, that we have so much data to remember and to work it out in our eco labs and other fields. It's making our life difficult. And one particular thing that appealed to me a lot is about the myocardial footprint, which probably can replace MRI in at least some scenarios. So, that's indeed something to look forward to. So, hearty congratulations and keep up your good work so
Thank
that
you.
we really find the implementation of that work very soon in our labs.
Partho, it will sound a little stupid. I'm asking a very basic question. We get a lot of everything which is new coming up in echocardiogram, whether it's a strain imaging, it basically depends on the quality of the 2D picture. Unless you get a proper 2D picture, you cannot do these things properly. Is AI in any way going to help us in getting a good 2D picture in patients who are difficult to scan?
So I have
other than ourselves adjusting the machine knobs and the buttons, how AI is going to help us in improving the quality of the basic picture?
Yeah, so I'll tell you, I have two responses. Number one, there are currently some systems which are using AI techniques to automatically adjust the image quality. when you put the images, you get the images. You can have an automated, depending upon the signals, depending upon how the images are coming. So think about a future where you put the transducer, and there is a probe called as I don't know if it's available, butterfly. It's a pocket ultrasound. The ultrasound probe, the minute you put the probe, it says this is a foreshortened image. Rotate it more. It will actually steer you. It will actually make you steer the probe. So right at the level of acquisition of the images, so standardization of the images, AI can guide the sonographer to take the right type of image. So the image quality. Most of the time, people are not paying attention to the image quality, foreshortened images. These are the reasons for variability. Number one. Number two, if you have a noisy image, how should the compression be adjusted? Now, I think you do manually, right? Think about an algorithm that it sees the images, it automatically runs the knobs for you and gets you the right compression with endocardial border resolution and all that. That would be very helpful. So it's good to know about these techniques, but it takes time. So if there is a way for us to move away from manual adjustments and there was an automated adjustment automatically responding to each individual image, that will be terrific. In fact, you'll be surprised that in not in echo as yet, but in MRI, there are sequences that are done by AI techniques automatically for patients for different types of sequences, LG sequences, based upon they do the first layer of scanning, and based upon the scanning, it will automatically adjust the sequences to get the right resolution images and all. So same way, think about it, like you put in a 3D probe, let's say, you're just holding a 3D probe, and besides guiding you the finer adjustment, it automatically adjusts and gives the quality of the image. Number two. Number three, in just this month, Jack Imaging, myself and Tom Marvick, we wrote an editorial on how a gatekeeper for the quality of the images is important, because you can't apply, for example, when you're doing a strain imaging, people just apply the strain imaging to all kinds of images. And, if the image is not a good quality, then your strain numbers are not going to be reliable. So how do you get an arbitrator? So you need a tool to be able to stop you. Don't apply strain if it's a foreshortened image, or if it's a noisy image, or the endocardial border. So actually there's a paper that is just published in which the deep learning algorithm automatically advises you that this is a foreshortened image. It will come up with the reasoning why this part of the image is not good. Don't take the information from here. So these kind of help will be very useful when common people in community practice, we are going in and employing images. We need to have our local assistant. There is no expert there. So the AI will be a helpful local assistant guiding us with the right kind of imaging. And, I don't want to expand this further, but in very near future, there are also robotic systems, just like you have autonomous vehicle. Same way, robotic system will be acquiring the images automatically for you. So you will be nicely sitting down, the images are getting captured, they're coming in front of you. You're doing high caliber work, you're capturing the other information of the patient, and you're elevating your decision and answering the question that is being asked. Just like in our cases, like when we go through. And every echocardiographer is basically, in my opinion, a very resourceful person to provide the blueprint of how that patient should be managed, what he's doing. Many times we don't do that very well. We just manually acquire the images and never communicate. So there's no time for communication. There's more need for tailoring therapies. Let's say that we saw that embolus. What if we cut that embolus, and what would happen if I would introduce anticoagulation? Will that dissolve? These kind of solutions and blueprint of therapies is what I think the images of the future are going to do by using models and putting that information and solving that solution. So if I'm answering you correctly, so you're right. If the quality of images is not good, no model can work. But AI could actually help us in that process to improve our imaging quality, and stop us from driving decision on poor images quality, stopping us from making measurements or strain from suboptimal images quality, telling us why this image is not good. So these kind of local decision support tools are going to be needed and will be embedded in your workflow to help you guide through your day.
I feel there is no further question. Thanks, Partho, once again. But please reassure us before you sign away that you will be with us in our future meetings as well.
Yeah, I'll look forward to it. Absolutely. Zoom has created all kinds of possibilities, and I also enjoy coming back to Calcutta once the pandemic ends. So look forward to.
We can assure you good Bengali food, which you
Yes.
will get in Nagpur as well all the time.
Yeah, no, look forward to it. Thank you. Thank you for the invitation.
Thank you, Dr. Sengupta.
Thank you.
And thank you, chairpersons. We end this session. And in a short time, we are going to go into the quiz, which is going to be conducted by Dr. Aniruddha Dey. This preceding symposium, A Peek into the Future, the talk by Dr. Sengupta, was supported by unrestricted academic grant from GE Healthcare. We'll take a short break before Dr. Aniruddha Dey takes over.